welcome to the Two Piece Podcast. My name is Erica, and this is Brandy.
Hey guys, I am a registered dental hygienist with a local anesthesia permit, and I have been practicing in the dental field for the last 20 years.
And as I always say, I have not. I don't know why that cracks me up so much, but whatever. Anyway, if you guys are joining us for the first time, our podcast is focused on providing the underserved and underprivileged communities, particularly of people of color, with the information and tools to help improve their dental healthcare experience. A couple weeks back, guys, we did an episode, right, Bran? Brandy knows what I'm saying. I'm like saying right, Brand. I don't even say what the episode name is yet. We did an episode on oral sex. It was quite exciting. It was something we were chomping at the bit to do. At least I was.
Yeah, Erica was, because she's trying to get that be our first episode out the gate. And I was like,
I was super excited about this. And Brandy was like, no. I was like, okay. So we had a lot of views on this episode, like almost 4,000, right, Brand?
Child, it's like 8,500 now. You way out. You behind of the times.
I sure am. Like, this is me being away on vacation, okay, yeah. And not know what's going on. So I just disconnected from social media, y'all. Sometimes you got to do that. But anyway, so as Brandy stated, we're up there. So a lot of the viewers, you guys, had a lot of questions, right, Brand? So Brandy is going to answer these questions. I'm going to read the questions off, so of course you guys could know what everybody's curious about. It might be something that, because some people are shy, right? You got a lot of people introverted, and Absolutely. They don't want to ask these big questions because they're like, I ain't going to ask that, Yeah. So, all right. So here we go. Number one. Mm-hmm. Can I give cunnilingus? And if you guys don't know what that is, it's we went through this though, but it's oral sex from the man to the woman, right? Or no, on a woman, on a female. I'm not going to say from the man to a woman. I'm so sorry.
Oral to vaginal.
Oral to vaginal, yes, because it could be any. Yes, that's not. Sorry. Sorry. Okay. Can I give cunnilingus, or can my girlfriend give fellatio, which is on a man, oral sex on a man, after extractions or dental work?
So after an extraction, I don't know if you guys remember from the last episode, but you are not supposed to have any sucking motion of any kind. So that includes using a drinking straw, that includes spitting, and so that would include oral sex of any kind. And there's several reasons, because we talked before about the blood clot that needs to be formed for extractions to heal, right? Erica, remember that?
And right, I do.
Right, and then also you may have sutures there, and because you have that area that's healing, you don't want to introduce any bacteria into that environment. So where there are bodily fluids, there is bacteria, and a chance for that bacteria to get into those areas that we want to heal bacteria free for the most part. So yeah, and then also you are going to be numb for a longer period of time, especially if you're having wisdom teeth extracted, because they give you that long lasting numbing. And to be quite honest, you're probably not going to want to do anything like that. You're probably just going to want to relax. So I would say that no, you should not be doing that. That should be the last thing you're thinking about when you're trying to heal from extractions. Or even if you don't have extractions, any dental work, if you're having a filling, if you're having crowns done, implants, whatever it is you're having done, you want to focus on healing and, allowing yourself to not worry, because it's crazy to think about that. Like, you in the chair. We had a patient ask Erica, like, right in the chair, she like, oh, is it okay if I give oral sex right after this? Like, is that what you're thinking about? Like, you just had like 3 teeth. Three moved that. I'm like, okay, I mean, at some point, but today and for several days after, no. So you guys, I would say no, just wait it out.
Yeah, I mean, after that and the pain and the blood and the spitting,
yeah, it's
and
like, Yeah, I mean, she's not the first patient to ask that question, and once it's
Wow.
quickly, she can get back to it.
Guess they probably got a job to do. So like, listen, this depends on a lot of things that I got to get this working. Right, was like, listen,
I just am like, no.
Bills got to get paid. So I got to
For some.
For some.
A mess.
Okay. So question number 2. Can I give periodontal disease or gingivitis to my partner from cunnilingus?
Okay, so remember that's oral to vaginal. So I'm glad somebody asked this because I actually, if you guys go onto drbicuspid.com, it's a good article, and I actually sent you this article, Erica, because I wanted to read directly from it because there's some interesting things on here. So first of all, I just want to say that the bacterium that causes gum disease or periodontal disease, or also known as periodontitis, is linked to bacterial vaginosis. So there's been some studies that said that in the past, when women have had bacterial vaginosis, it's been classified as like an imbalance of the natural bacteria and flora of the vagina. However, they're starting to find that when they look under the microscope, they see the same bacteria that actually causes periodontal disease or gum disease and gingivitis. So those things can be found inside the vagina after oral contact. Bacterial vaginosis occurs when the normal balance of the bacteria in the vagina is disrupted. So we know that. And 29% of the women in the United States, mostly those between the ages of 15 and 44. So this condition typically occurs when women are sexually active.
So is it after 44?
Listen, they trying to act like you ain't getting none after 44. I don't know why they saying that.
I'm like, okay.
No, not true. But I'm just reading a little excerpt from the article. So that's what they're saying. So, but the condition, Erica, typically occurs between those ages. So women, as we know, are sexually active after that, but not so much having this issue.
But do know usually, both of us because we're 45.
Yeah. So listen, just look, speaking for the two of us, we understand that those age discrepancies as far as sexually active is incorrect. However, it also says that this bacterial vaginosis can be not only between ages of 15 and 44, but women who are sexually active who have multiple partners, and also if you are in the habit of douching. So some women douche and it disrupts that natural flora in the vagina. It can cause bacterial vaginosis doing that. So I've been told a long time ago not to do that. I don't know if there's
me too.
Do that.
They said don't douche, and they was like, don't do that. Like take your probiotics.
Yes. So that all can lend to it. But when you have bacterial vaginosis, it makes you as a woman more susceptible to other sexually transmitted diseases and infections. And so these things can also affect pregnant women. So that bacteria that's in periodontal disease and periodontitis, it can also be found in the amniotic fluid in preterm babies and low birth weight babies. So it is clear that yes, you can spread the bacteria from periodontal disease, from gingivitis, from periodontitis into the vagina, and it can cause issues. This was not understood to be the case before, but they are starting to find that this is.
I mean, it makes total sense, though.
Absolutely, it makes sense. I mean, like, one of our viewers commented about the exchange of fluids, and that's exactly what it is. You're exchanging bodily fluids, and it's bound to happen. You're bound to be able to pass things back and forth. So I just thought that was interesting. And this is on drbicuspid.com. And I think you can just go on here and type in if you want to read the rest of the article, but it's a pretty interesting, pretty interesting.
People don't know. They just be thinking, I don't know what they be saying, but they don't be thinking about that.
Not long or not.
Now they're probably like light bulbs going off in their head, like, oh my God, this is why this is happening to me.
You need to think twice.
All right, so on to question number 3. How long do I have to wait to resume oral sexual activity after dental work?
Okay, so this was a separate question, but kind of the same as
Yeah, I was going to say
I
it's
would say this is what I would say. What I would say is if you are having just routine restorative work, fillings, crowns, um, anything like that, root canal, then when the numbness wears off, you can do whatever you like. But for extractions, I will wait at least a week because that's the standard. We usually tell patients, no sucking through a straw, no smoking, no spitting or swishing for about a week's time after extraction. So I would put that in with the same thing. It makes sense. And that's what we tell patients if they ask us this question.
okay. And then question number 4. Can I still give fellatio, which is oral sex to a man? Like, I hope I'm saying this politically correct. Is it?
Yes, and
Is it man? Okay, who knows?
or yes.
A man. I don't know. Somebody with a penis.
Look, oral to penile.
Yes. Okay.
There we go, because that
Can,
makes
can I
sense.
still give fellatio with braces?
Okay, so this is an interesting question because I've gotten this question many times. And before I get into it, I just want you guys to know that if you have questions, we are healthcare providers. So please, just like Erica said in the beginning episode, do not feel bad about asking questions because I mean, what you gonna do? Go out in the street and ask somebody, Google it. Like just ask a professional because we'll give you a simple answer and trust, trust, trust. We've been asked these questions so many times.
She's been asked those questions.
Well, I was saying
you said she and her people are healthcare
well, I
professionals.
said we as in healthcare providers.
I'm like, it ain't me.
So yes, healthcare providers has been asked these questions, and that's what our job is to be able to provide information. So please don't feel bad about asking questions. But anyway, so this is pretty interesting. I made a couple notes for you guys because I didn't want to forget stuff. But so there's not much research on the effects of oral sex and braces, but it's a good idea to be very careful because remember, if you're wearing braces, you have a lot of hardware. Erica, you had braces. I had them. The brackets are metal. The wires are metal.
Mhm.
Even if you're using ceramic brackets, they're still sharp and they're still metal wire. So there's a lot of issues if you do that. Whether actually Erica is fellatio or cunnilingus, so it can go both ways, is what I'm saying. So oral to penile contact, oral to vaginal contact with braces. I'm sure there are some things that you should be aware of. First and foremost, when you have braces inside your mouth, you can have sores inside your mouth from the brackets rubbing up against your cheek, rubbing up against your lips, right? You got the wires in there. So that's for the person who is giving, right? And for the person receiving, they can receive cuts and injury from the metal brackets as well. So whenever you have those kind of cuts or opening and tears in skin, it's just an easy way to transfer bacteria, to transfer STIs, to transfer any kind of sexually transmitted disease, as well as the bacteria that's inside your mouth. So that's something to think about. And also someone could have herpetic lesions or herpes on their lips or inside, and that you can transfer, especially if there's a cut. I mean, to be quite honest, even if you're using a barrier, Erica, like a dental dam or a condom, those metal brackets or wires can scrape microscopic tears in those barriers because they're metal and you might not be able to see it, but then you can still transfer things. So it's really something to think about. I mean, I don't know how serious it is that you have to do that or get it done when those things are in place. But listen, I guess as a personal preference, but just be aware that there is a risk when you do those things. So it's a really interesting question that somebody asked that about braces.
So crazy. Because it's like now it's like if you're on a dating site, dating preferences, wherever, like, you got braces?
Yes, exactly. Let me find out.
Well, that's
your
no
own risk.
braces. Check mark, no braces. Or
No,
like, you got braces?
there's a box.
When are they coming off? Because that's not gonna work out. Well, I guess that's the bottom line, y'all. You got to go to the dentist. You got to check and make sure you good. Cause
It's at your own risk. And then there's one other thing I wanted to mention. So for people who are concerned about receiving let's say oral sex, oral to penile, and you're the receiver, right? You have a penis. So of course there's a lot of blood flow
What?
happening.
I can't stand you. You have a penis? What?
But listen, there's a lot of blood flow going on down there. And typically, if there's some kind of injury of sorts from any of these metal, it's going to cause heavy bleeding. Just so you guys understand that, because of all of the blood flow in that area. So it is something to consider. So, but I just want to thank you guys for looking and checking out this episode, because and check out the rest of the episodes, because the information is really important, like especially for people who have no idea about dental things. It's really vital information for you guys. And to all of our new subscribers, thank you for supporting the channel, and we will keep putting out the content. And if you guys have any suggestions for content or even how we can improve the podcast, just let us know. truthbetoldpodcast@gmail.com.
Yes, as she said, thank you so much, guys. We know this is it's important information, but this is very entertaining as well.
It's really interesting, right?
Yes, it is.
It is. You guys did a good job with the questions.
Yes, absolutely.
And hopefully it'll help somebody else who might have had the same question.
Yep. All right, guys. As always, thank you for tuning in, and check us out next week.
Yep. We'll see you then. You guys take care.